Encephalitis. It's a word that can strike fear into anyone, but it carries a particularly heavy weight when it comes to seniors. This inflammation of the brain, often caused by a viral infection, can have a profound impact on the lives of older adults. As we age, our immune systems naturally weaken, making us more susceptible to infections like encephalitis. What might manifest as a mild headache in a younger person can quickly escalate into a life-threatening condition for a senior. The silent nature of encephalitis is perhaps its most insidious trait. Its symptoms often mimic those of other common ailments, leading to delayed diagnosis and treatment. This is why it's crucial for seniors, their families, and healthcare providers to be aware of this silent threat. Early detection and prompt medical intervention are paramount in mitigating the potentially devastating consequences of encephalitis in seniors. This is a battle we can win, but only if we understand the enemy and remain vigilant in its presence.
Encephalitis, an inflammation of the brain, can be triggered by a variety of culprits. Viruses, those microscopic invaders, are the most common offenders. Herpes simplex virus, the same virus responsible for cold sores, can also infiltrate the brain, causing encephalitis. Other viral suspects include West Nile virus, transmitted through mosquito bites, and varicella zoster virus, the culprit behind chickenpox and shingles. While less common, bacteria, fungi, and even our own immune systems can turn against us, leading to encephalitis. Certain factors can increase a senior's susceptibility to this brain inflammation. Age-related weakening of the immune system plays a significant role, making them more vulnerable to infections. Existing health conditions such as diabetes or heart disease can further compromise their ability to fight off these invaders. Understanding the potential causes of encephalitis is the first step in protecting our seniors from this formidable foe. Encephalitis is a master of disguise, often mimicking the symptoms of other age-related conditions. This makes it particularly challenging to diagnose, especially in seniors who may already be experiencing cognitive or neurological changes. One of the hallmarks of encephalitis is a sudden onset of fever, often accompanied by headache and a stiff neck. Confusion, disorientation, and memory problems can also signal trouble brewing within the brain. Seniors may exhibit more subtle signs such as drowsiness, lethargy, and a general decline in mental function. Changes in personality, agitation, and hallucinations are also red flags that should not be ignored. It's crucial to remember that these symptoms are not exclusive to encephalitis and could indicate other health concerns. However, any sudden or significant changes in a senior's mental or physical state warrant immediate medical attention.
Diagnosing encephalitis is like piecing together a complex puzzle requiring a multifaceted approach. Doctors begin by taking a detailed medical history, including any recent illnesses, travel, or exposure to insects. A physical exam focusing on neurological function helps assess mental status, reflexes, and coordination. To peer inside the brain, imaging tests like MRI and CT scans are invaluable tools. These scans can reveal any inflammation or swelling within the brain tissue. Analyzing the cerebrospinal fluid, the protective fluid surrounding the brain and spinal cord, is crucial. A lumbar puncture, also known as a spinal tap, is performed to collect a sample of cerebrospinal fluid. Laboratory analysis of this fluid can detect the presence of infection or inflammation. Early and accurate diagnosis is the cornerstone of effective treatment. The sooner encephalitis is identified, the better the chances of a positive outcome.
Treatment and management. Battling the inflammation. Treating encephalitis is a race against time, aiming to quell the inflammation raging within the brain. Antiviral medications are the first line of defense against viral encephalitis, the most common form of the disease. These medications work by halting the replication of the virus, giving the immune system a fighting chance. Corticosteroids, powerful anti-inflammatory drugs, are often used to reduce brain swelling and alleviate pressure. In severe cases, hospitalization may be necessary to provide supportive care, such as intravenous fluids, oxygen therapy, and close monitoring of vital signs. Rehabilitation plays a crucial role in the recovery process, helping seniors regain lost function and adapt to any lingering effects of the illness. Physical, occupational, and speech therapy can aid in restoring mobility, independence, and cognitive skills. The road to recovery from encephalitis can be long and challenging, but with prompt treatment and unwavering support, seniors can reclaim their health and well-being.
Complications. Navigating the aftermath. Encephalitis, while treatable, can leave a lasting impact on a senior's health. The severity of complications varies depending on factors such as the cause of encephalitis, the speed of diagnosis, and the individual's overall health. Some seniors may experience lingering neurological effects such as memory problems, difficulty concentrating, and personality changes. These cognitive challenges can impact daily living, making it difficult to perform routine tasks or engage in social interactions. Physical limitations, including weakness, paralysis, and difficulty with coordination, are also potential complications. These physical impairments can affect mobility, making it challenging to walk, bathe, or dress independently. In some cases, encephalitis can lead to seizures, a sudden surge of electrical activity in the brain. Seizures can manifest as convulsions, loss of consciousness, or subtle changes in behavior or sensation. While these complications can be daunting, it's important to remember that with appropriate medical care, rehabilitation, and support, seniors can adapt to these challenges and live fulfilling lives.
Personal stories triumph over adversity. Behind every diagnosis of encephalitis lies a personal story of resilience. Meet Helen, a 72-year-old grandmother who developed encephalitis after shingles. Her initial symptoms, fatigue and confusion, were mistaken for stress. When Helen's speech slurred and she experienced weakness, her family knew something was wrong. A trip to the emergency room confirmed their fears. Helen had encephalitis. With treatment and rehabilitation, Helen began to recover. Helen's story is a beacon of hope, showing the triumph of the human spirit.
Prevention and caregiving. Shielding our seniors. Protecting our seniors from encephalitis requires a two-pronged approach: prevention and vigilant caregiving. Vaccination plays a crucial role in preventing viral encephalitis. Ensure seniors are up to date on their vaccinations, including those against the flu, pneumonia, shingles, and West Nile virus. Simple hygiene practices can also make a world of difference. Encourage frequent hand washing, especially before meals and after using the restroom.
Caregivers are on the front lines. Their watchful eyes and unwavering support invaluable in detecting and managing encephalitis. Educate yourself about the signs and symptoms of encephalitis and be attuned to any changes in a senior's behavior or health. Maintain open communication with healthcare providers, reporting any concerns promptly. Provide a supportive and stimulating environment for seniors recovering from encephalitis, engaging them in activities that challenge their cognitive and physical abilities.
Conclusion. Early action, lasting impact. Encephalitis, a formidable foe, poses a significant threat to the well-being of our seniors. Its silent approach, often masked by subtle symptoms, makes early detection a formidable challenge. However, armed with knowledge, awareness, and a proactive approach, we can mitigate the risks and improve outcomes for our loved ones. Vaccination, hygiene practices, and vigilant caregiving form the cornerstones of prevention. Timely diagnosis and aggressive treatment are crucial in battling this brain inflammation. The road to recovery may be long and arduous, but with unwavering support and comprehensive rehabilitation, seniors can regain their independence and enjoy a fulfilling life. Let's remain vigilant, advocate for our seniors, and empower them with the knowledge and care they need to thrive in their golden years. Remember, in the realm of encephalitis, early action can have a lasting impact.